Hi all, and welcome to the Prenatal through age 25 Behavioral Health Legislative Implementation Webinar Series for December. We appreciate you all joining us today. As we get started, I just have a few housekeeping items for the room. To please mute yourself if you're not speaking. Raise your hand if you would like to speak. And please know that this time is for you. We welcome all questions, comments, and feedback during the presentation. However, we would ask you to put your questions in the chat so we can save them for the Q&A. The agenda is heavy today, so I just want to make sure everybody has time to present and then also allow time for Q&A at the end. If you cannot answer your questions on this call, we'll follow up after the meeting. A quick disclaimer, this Zoom meeting is being recorded and will be posted to the HCA webpage. This recording is open to public disclosure, so please do not provide any information that is private or confidential. Something to keep in mind. The agenda today focuses on these 10 programs coming out of the Prenatal through 25 team. And I will hand it to Diana to do introduction and welcome the participants today.
Thank you, Jennifer. Hello, everybody. Thank you for joining us. My name is Diana Cockrow, which I get to play the role in the Healthcare Authority supporting the amazing work of the Prenatal through age 25 Behavioral Health section. Some context and framing for this particular update series. Last legislative session, House Bill 1800 gave resources to the Healthcare Authority to support communications for the prenatal through age 25 behavioral health section of the Division of Behavioral Health and Recovery. A goal of these resources is to increase regular communication about our legislative implementation and fund an FTE. So starting in July, Jennifer joined our team, and we continue to be incredibly grateful, Jennifer, for your work and support of the team in communications. We have about 15 to 20 implementation initiatives that came to the section in the past legislative sessions. After today, this series will pick back up after legislative session this spring. So please consider sharing your candid feedback in a survey that will be coming your way to help us shape next year's legislative implementation series. A little asterisk / teaser, we have about the same number of programs, pilots, and policy that are ongoing from the team. While this series today focuses specifically on legislative implementation, we are working on a newsletter to highlight other areas of work across the section coming in the next month or two on a regular basis. So all that, but we'll clarify for today, this presentation and question and answer will be on legislative initiatives. For each implementation presentation, you'll hear a little bit about the language in the bill or the budget proviso that funded it, and a rough timeline for the work and where we are in the process of rollout. Look forward to hearing your thoughts and questions in chat and in question and answer afterwards. Thank you for joining us today. Jennifer, back to you.
Thanks, Diana. As I said, we have quite the lineup today for presenters and topics. If you have any questions after this meeting, these slides will be available to you, and all of the contact information for the presenters today is on the Meet the Presenter slide. So feel free to reach out to them as you see fit. With that, I will turn it over to Larissa to talk about the CLIP program.
Good afternoon, everyone. My name is Larissa Foray, and I am with the Healthcare Authority in DBHR section. And I am here to talk about CLIP. I am the CLIP administrator. And so just to provide an overview of CLIP, CLIP is the most intensive long-term psychiatric treatment available for youth 5 to 17. It is funded by a 50-50 match and provides multidisciplinary psychiatric treatment. Our average length of stay is about 8.5 months, with some youth discharging sooner or some staying longer depending on their needs. And the goal of CLIP treatment is to transition children and youth back to their homes and communities at the earliest clinically indicated time. So we received some funding to increase the bed capacity in the CLIP system. And when I'm discussing the bed capacity, I'm referring to the contracted CLIP bed capacity, because CLIP also includes Child Study and Treatment Center. And so I'm not referring to beds at Child Study and Treatment Center, CSTC. I'm only referring to beds that are contracted at our 3 CLIP programs, which is Pearl Street, Tamarack, and 2 Rivers Landing. Thank you. And so we are working to increase beds to 62 by the end of fiscal year 22 and to 72, I think it's supposed to be 72, but maybe it's 71 to 2023 by the end of fiscal year 2023. We have 2 providers that are actively looking and researching their readiness and are very interested in standing up CLIP services. And the rates, there is a 4.5% rate increase that becomes effective January 1st of 2023. And next slide. So our bed utilization changes daily depending on census. Current availability of contracted CLIP beds is 52. And our monthly average for utilization is about 37. And for provider updates, we do have, like I said, 2 interested providers, and discussions are occurring with other providers at this point. There are some challenges with providers, meaning current and interested new providers, and workforce shortages that we're seeing across behavioral health and across their fields. And there's some competitive rates in hiring and retaining staff. So we're working on those things, and some of the new providers are working through the permitting and licensing process. Next slide.
That's all I have for you, Miss Larissa. I appreciate the update on CLIP.
Thank you.
As we move along, I'd like to introduce Rachel Baxter, who is new to our team for an education discharge for planners for safe and stable housing for youth and young adults. Miss Rachel.
Good afternoon. Again, my name is Rachel Baxter. I'm the Behavioral Health Transitional Age Youth Stable Housing Policy Lead here at HCA. First, I want to give some brief information regarding the work HCA has done to implement it for planning for the Education and Discharge Planning Toolkit. In July of 2021, the Healthcare Authority Division of Behavioral Health and Recovery, in partnership with the Rakes and Schultz Foundation, supported an FTE position, which created the report titled Safe and Supportive Transition to Stable Housing for Youth Ages 16 to 25. It has best practices and recommendations for strong supportive communities. Within the report, you'll find data from Away Home Washington and the Office of Homeless Youth. The data shared by those agencies identified that 2 out of 3 young people ages 13 to 24 experience homelessness after they are discharged from a public system of care, and 1 in 5 transitional age youth are homeless within 12 months of exiting an inpatient behavioral health treatment facility. Within the research conducted, inpatient mental health or substance use disorder programs were not easily identifiable and found no specific program design framework. This includes discharge planning, which is important when serving the unique developmental needs of young adults. Inpatient treatment can be a rare opportunity to engage with young people and can complete a comprehensive and holistic assessment for successful discharge and community reintegration. During the legislative session in 2018, Washington State passed Substitute Senate Bill 6560, requiring Washington State Department of Children, Youth, and Families and the Office of Homeless Youth to co-design a plan to ensure no youth is discharged to homelessness by any public system of care. Later in 2022, to further this legislation, House Bill 1860 and 1905 were also passed. House Bill 1860 identifies that inpatient treatment facilities must engage in discharge planning with Medicaid managed care organizations, whereas House Bill 1905 identified the need for a rapid response team and flexible funding opportunities to support youth and young adults exiting any publicly funded system of care. In support of these initiatives, HCA is currently problem solving with DCYF to restore Medicaid coverage 30 days prior to release within correctional systems. This would ensure people can access critical care as they are released, and that housing insecurity is identified and discussed earlier. This also gives the opportunity for discharge planners to ensure a more comprehensive and realistic transitional plan to achieve once exited from these systems. The Department of Children, Youth, and Families Juvenile Rehabilitation has also hired a discharge liaison who will work with transitional age youth on reentry plans that will include housing discussions. Next, I want to give a quick overview of the notification system that is currently within the developmental phase at HCA. This system asks providers to notify managed care organizations that an individual is being discharged from a behavioral health facility with housing insecurity if applicable. This will give discharge planners the opportunity to work with managed care organizations to ensure care coordination and housing resources are offered. This effort will create a positive impact on individuals who may need additional assistance and support when exiting an inpatient treatment program. For House Bill 1905 specifically, DCYF is spearheading the rapid response team design and implementation. Additionally, a position has been created to ensure a liaison will work closely with other state agencies, providers, and the individuals being referred to the rapid response team for housing instability. The liaison will problem solve and ensure diversion conversations have been done at the lowest level prior to a rapid response team referral. The rapid response team will give individuals and discharge planners the opportunity to send in referrals and conduct case conferences to see how each agency can connect to housing opportunities that may not have been tried previously. Again, the rapid response team is still being developed at this time. DCYF convenes a monthly interagency meeting with HCA, OHY, DSHS, DDA, and others to discuss programs, educational, and problem-solving opportunities. Additionally, HCA has created internal work groups that include HCA staff from all sections as foundational supports to this initiative. Information regarding those work groups can be found on our website. The 4 work groups include data, payment, policy, and standards of training, which will reconvene in January of 2023. HCA also is currently in development of the Discharge Planners Toolkit. This will be an online survey that discharge planners may use prior to individuals exiting a facility to find housing options and programs that an individual may qualify for. HCA is also in the process of adding housing resources specific to transitional aged youth on the Pathways to Housing website. These online resources are also a way for providers to find out what housing resources are available within their local area. With these tools, providers will be better equipped to find safe and stable housing that will support an individual's recovery. So on this slide, you'll be able to see the links for housing for transitional youth. You'll also find the report regarding inpatient treatment and discharge to homelessness, as well as the Office of Homeless Youth report and dashboard. Thank you.
Thank you, Rachel. I do want to put in another plug that there are a substantial number of resources for this team who's participating today. So if you do have any questions, please feel free to use the resources on this slide and reach out to Rachel if you have any questions. And now I will turn it over to Ashley for Grace Harbor Family Preservation for Pregnant and Parenting Women.
Hello, everyone. So happy to be here. My name is Ashley Pena, and I am the Pregnant and Parenting Family Substance Use Disorder Policy Administrator with the Division of Behavioral Health and Recovery with Washington Healthcare Authority. Next slide, please. An overview of my role as a Pregnant and Parenting Family Substance Use Disorder Policy Administrator is to develop, administer, and manage the Division of Behavioral Health and Recovery, Substance Use Disorders statewide treatment program for Washington State parents in need of treatment. Leading the Grace Harbor Project using a family preservation model to support wellness of the whole family while parents navigate recovery and parenting. In addition, the cross-agency design and implementation team includes the Washington Association for Alcoholism and Addiction Programs and current parenting partners, early childhood development, prenatal through 5 cross-agency team, the Family First Preservation Act team, and the Department of Children, Youth, and Families and other state agencies. Next slide, please. The Grace Harbor Family Preservation for Pregnant and Parenting Individuals budget for the fiscal year of 2023 is $1,135,000. Of that, $568,000 of the general funds is directed to be used to develop and operate a 16-bed substance use disorder inpatient facility in Grace Harbor County, specializing in treating pregnant and parenting individuals using a family preservation model. This includes startup costs, recruitment, training, and hiring of staff. Next slide, please. In addition to the budget overview, the Grace Harbor Family Preservation for Pregnant and Parenting Individuals provisional language is to develop and operate a 16-bed substance use disorder inpatient facility in Grace Harbor for pregnant and parenting individuals, including fathers, using a family preservation model. The facility must allow families to reside together while a parent is receiving treatment for substance use disorder. This is a part of the family preservation model. And the authority must contract for these services through the behavioral health entities in a manner that allows leveraging of federal Medicaid funds to pay for a portion of the cost. The authority must consult with the Department of Children, Youth, and Families in the implementation of this funding. And this concludes my very short, but hopefully informative presentation. Thank you for your time.
Thank you, Ashley. And welcome to the team. We're happy to have you.
Thank you.
Now, I'll introduce you to Mandy Huber for the Neuro Development Behavioral Health Treatment Center, otherwise known as Habilitative Mental Health. Mandy.
Thank you, Jennifer. Good afternoon, everyone. Again, my name is Mandy Huber, and I will be talking to you about the Neurodevelopmental Behavioral Treatment Center, NBTC as we are referring to it. Previously, the Habilitative Mental Health CLIP program. And so we have renamed it, and we are have been given funding by the legislature to contract for a 12-bed children's long-term inpatient facility that will specialize in those habilitative mental health services for children and youth with intellectual and developmental disabilities who also have intensive behavioral support needs. And so we are tasked with implementing that and then providing data on the demand and utilization of the facility by June 2023. Updates on implementation include that we sent out a request for information in January 2023. We did not get any applicants. So we started holding an advisor stakeholder committee to really, which is made up of specialists, providers, system partners, to really look at building the program to provide it and make sure we are providing all the services necessary, looking at the scope of work, and of course the funding to ensure that there is enough funding. And so we are continuing to work to build a program also within the current legislative language and funding, but have sent forth a request for further funding. So we have found that there have been real challenges in finding a provider that's really able to create a new innovative scope of work right now. And so with workforce shortages and challenges, taking on a new innovative program has been difficult currently, but we are working to strive for that. And so provider program work and details continue in order to find that provider who can provide the treatment to this specialized population. And this will be for residents, youth residents of Washington State under 18.
Thank you, Mandy.
Thank you.
Now I will introduce you to Liz Veneto, who is going to present New Journeys for this month.
Hi there, my name is Liz Venuto. I'm the Transition Age Youth Integrated Services Supervisor with the Division of Behavioral Health and Recovery. I have the pleasure of supporting the subject matter experts over the first episode psychosis work. For some orientation, psychosis refers to a cluster of symptoms that impact an individual's perception of reality and interfere with their daily functioning. And first episode refers to the first experiences of those symptoms. Each year, it's estimated that more than 2,000 youth and young adults in Washington experience the first episode of psychosis. And data shows that experience with psychosis impacts things like graduation rate, disrupts employment, increases substance use, visits to the emergency department, hospital admissions, risk of legal trouble, risk of becoming homeless, and risk of suicide and premature death. There is hope. Research shows that the earlier psychosis is identified and treated, the more likely someone is to experience remission of symptoms, resulting in improved daily functioning for that individual and decreased financial burden to the healthcare system. The focus of the program isn't just symptom management, but actual recovery. Coordinated specialty care is the best evidence-based practice for first episode psychosis, and the model was chosen by Washington's New Journeys program. This treatment model provides access to services as soon as symptoms emerge rather than waiting for someone to become severely or chronically ill, involves a multidisciplinary team providing a full range of person-centered, community-based services that includes an individual's natural supports. To make sure that we're screening and increasing access to New Journeys, there's also a public education and outreach component so that clinicians and community members can recognize and make rapid referrals for youth and young adults that might be experiencing a first episode. And since 2015, New Journeys has continued to challenge historic ways of thinking about major mental illness, which often include limiting beliefs around someone's potential once they've been diagnosed with something like schizophrenia. So New Journeys doesn't do that. Instead, the model offers hope and real healing to young people during the most vulnerable times of their lives. Next slide. Knowing the impact and reduced prospects for long-term recovery when there's a delay in treatment, in 2014, the United States Congress directed that set aside funding from the federal mental health block grant be used to help states develop their first episode psychosis treatment programs. That set aside initiated Washington State's New Journeys program implementation in 2015. In 2019, Washington State's Children, Youth, and Family Behavioral Health Work Group advocated to the legislature for Second Substitute Senate Bill 5903. And that legislation called for the creation of a statewide implementation plan for evidence-based recovery support, the development of a financing strategy for Medicaid, and the statewide expansion of New Journeys based on incidence and population. So the statewide implementation plan was submitted to the legislature in 2021. It provides a roadmap for financing and continued expansion of New Journeys. Several of the components that are included in New Journeys are difficult to fund using conventional Medicaid or commercial insurance. Treatment teams have been financed using mental health block grants, 10% set aside, blended with state funding up to this point. As directed by legislation on July 1st, 2022, funding for New Journeys was moved from the mental health block grant to Medicaid through the implementation of a team-based rate developed through an actuarial process using the data from our current New Journeys programs. State funds are directed to support those who are uninsured and underinsured and to cover services that aren't covered by Medicaid. The statewide plan also emphasized the need for future legislation to mandate commercial parity to ensure that these evidence-based interventions are available to all those in need. So we have a map on the next slide, and there are currently 17 New Journeys teams across 9 regional service areas in Washington. 11 of these sites are fully operational and 6 are in their startup phase as a result of continued expansion efforts. Based on these numbers, there's a clear need for the continued expansion of New Journey services. So we'll see continued expansion over the next few years. As we continue our expansion throughout the state, we're really focusing on increasing equitable access to treatment for first episode. These efforts will address diversity, equity, and inclusion within the evidence-based work by focusing on culturally responsive adaptations to the existing model. These adaptations aim to better serve those who are American Indian, Alaskan Native, and those living in rural areas where access to resources may already be limited. And just to sum up, New Journeys is a really cost-effective model. It's highly beneficial to those experiencing their first episode. It's aligned with value-based care delivery, redirecting usage of costly inpatient care to lower cost outpatient care and supportive services. And it really does work to break down barriers created by stigma around major mental illness. The emphasis on community education, early screening, and no wrong door approach to accessing treatment really helps break down some of the silos that we can see in traditional outpatient treatment. Thank you.
Thank you, Liz, and thank you for stepping in and presenting today. Next on the agenda is the Parent-Child Assistant Program with Sarah Pine.
Hi, good afternoon. I am Sarah Pine, Behavioral Health Program Manager for the Division of Behavioral Health and Recovery. I'm presenting on the Parent-Child Assistance Program, commonly referred to as PCAP. PCAP is a 3-year intensive case management program located at 15 sites statewide, serving a total of 20 counties. There are currently 1,490 client slots that are contracted with PCAP providers statewide, and PCAP receives both Medicaid and state funding. Next slide. A quick overview of PCAP services. PCAP offers referral support and advocacy for SUD treatment and continuing care. They offer assistance in accessing and using local resources such as family planning, safe housing, healthcare, domestic violence services, parenting, education and skill building, child welfare, childcare, transportation and legal services, just to name a few. PCAP also provides linkages to healthcare and other therapeutic interventions for the children of enrolled clients, and they aim to offer timely advocacy based on the needs of the client. Next slide. Over the past 5 years, PCAP has grown in a stable manner, showing an increase of 200 client slots from 2017 to current. The per client rate range has also increased, showing in 2017 to be from $457 to $516, and now in 2022 at $609 to $688. The PCAP per client rate is a range due to supporting higher costs in urban areas as well as legacy programs. Next slide.
Oh, sorry, that was my delay. I'm sorry.
You're good. The in-gross substitute Senate Bill 5693 supplemental operating budget provided funding to increase rates to PCAP over the biennium. In July of 2021, a 2% increase was made in PCAP contracts. In January of 2023, an additional 4.5% increase will be made. This will bring the per client rate up to a range of $623 to $703. Next slide, please. The University of Washington ADAI, formerly known as BADU, provides PCAP sites with quality assurance, implementation fidelity of the program model, staff training, and program data collection and evaluation. This data and evaluation of the program is provided to DBHR in monthly updates, as well as annual reports. You can learn more about PCAP by visiting the provided link. Thank you all for your time today and your interest in the Parent-Child Assistance Program.
Thank you, Sarah. Staying on the parent side of the house, we'll move to the parent portal with Stephanie.
Wonderful. Thank you, Jennifer. It's wonderful to be here presenting to everyone today. As a reminder, I showcased this slide at our last implementation update, but just want to make sure I'm orienting everyone to our legislative responsibilities around what it is that we're delivering. So we are part of House Bill 1800, in which it states that we are to design and implement a parent portal to connect families to service and education infrastructure related to behavioral health services for children ages 0 to 17. Part of our work expands beyond a bit of the scope of just what's called out in House Bill 1800. And I'll also point out in that we're helping to service children ages 0 to 25. So the intent is to really help children and youth through that transition phases of learning more independence and helping to be kind of on their own, and what that means when you are carrying some behavioral health diagnoses with you. The other point I want to call out before I move on is that we have transitioned the name from a parent portal to now we are calling it BH360, which stands for Behavioral Health 360. And what you're seeing on this screen is some screenshots of the prototype of the website that we have up and available for anyone who wants to go take a look. You can go on to the next slide. This slide highlights how we're thinking about the site being able to help families in a tiered fashion. And so the intent is to be able to help families no matter where they are on their behavioral health wellness journey with their child. The idea is for some families, when you're at different phases, the types of resources that you need access to will change. And so inherently what we're trying to do is make sure that we have a breadth of resources and information to help support you no matter where you are. So for those who are earlier on their journey, and I recognize that this is a bit of an oversimplification of what the journey can actually feel like to a caregiver, but when you're earlier on in your journey and you're noticing some challenging or concerning behaviors, you can go on to BH360 and answer some screening questions about those behaviors that you're observing. And based on those answers you provide, we will give you some personalized information regarding psychoeducation, parent help, some toolkits about some potential diagnoses that you might be challenged with, that your child might be challenged with, as well as connection to local community-based culturally competent resources. I'm going to talk a lot about that more today. If you are a little bit further on your journey, so perhaps you already have a diagnosis for your child, this is a way to come on to the site and to continue to access some of that personalized information, find more local resources in your area, as well as begin to connect with other families who have lived experience that can help shed perspective on what their journey was like to help you with yours. And then lastly, one of the things that we want to make sure we have access to for families is the ability to navigate your legal rights and understand what kind of supports you have inherently in the system and how to navigate the system. Because when you have more complex challenges, or you've been on this journey for a long time, there's going to be a need to understand how all the things connect and what types of ways you can help advocate for yourself and for your family. You can go to the next slide. This slide here just shows a little bit more tangibly what a family can expect when they come onto BH360. This is the types of resources and information that we'll be connecting you with. And again, you'll get that personalized aspect because you'll be answering screening questions for those that do. You don't have to answer screening questions to access all of this information. The screening questions just help us narrow what kind of information will be most impactful or relevant for your situation. You'll have access to parent psychoeducational information as well as children's psychoeducational information, school resources, community resources that are both youth-focused and parent-focused, and of course, behavioral health providers in your area. If you go to the next slide, what I'll show is what it might look like in an example use case. And this is just an example that is completely made up. So don't take any of this in terms of the content, but the concepts are what you should be grasping from this. So this is an example of a 12-year-old boy. He is male, cisgender, his family is Micronesian, and his family are immigrants. They're actually refugees that came to the US in 2015. They live in Kent, and we've gathered this information from things that they have told us when they signed up for the site, as well as information that they provided in the screening questions. And so what we're seeing is that he's failing his classes except for science, where he loves his teacher. He's being bullied in school, and he's getting in fights with some of his peers. And the other aspect that we're seeing as well is based on the answers provided, the mother has indicated some food scarcity concerns. So what you see here in the gray is all information that was provided either through registering for a profile, in which you'll give us some high-level demographic information about yourself, as well as what we're seeing in the question, in the answers that were provided to our screening questions. What you're seeing in the yellow is then how BH360 will help connect you to impactful information that can help support you on your journey. So the next slide, if Jennifer, you want to move on one more, will show what you would receive back as the caregiver once you have completed the screening questions. And so this is an example of what you'd be provided that can be printed out, and you could actually walk away with this and begin to access some of the meaningful resources that we have on our site. You'll have caregiver resources in the area, again, some food resources because you indicated that food scarcity might be a challenge, providers in your area, and school resources. So here are the resources that we found most relevant given the answers to the screening questions and what we were able to garner from the information provided by the family. The idea is that even families who don't have access to a smartphone or a computer could go into a library and access BH360 and then walk away with a printout that can help them on their way. If you go to the next slide, I'll talk a little bit about where we are on our journey in developing the site. So we have a prototype developed, and we are continuing to showcase that prototype and evangelize some of the work. We are looking for some additional private funding to help support the full development of the site, which will take roughly 10 months from the time that we formally kick it off to get that started or to get that completed. The other thing that we are thinking about doing in the intervening time is doing an intermediary pilot where we can start to evaluate the efficacy of the platform in some underserved communities. Our focus first and foremost is to help those in the communities who are furthest from reach, but most in need. And so we're going to try and figure out the most effective ways to do so. And then I think I have one last slide, which is about asking for participation. So as we think about those local in-community resources that can help families more immediately, there are lots out there and lots difficult to find, but we want to gather as much information as we can about some of them. And so we would welcome those attending today and participating in some of our surveys to collect information about them. We're collecting both quantitative and qualitative information so that we can start to reach out and connect with some of those resources and make sure that we can categorize them appropriately so that as families participate in our site, we're providing those that are most relevant given their particular needs. And that's all I have. So thank you all.
Thank you, Stephanie. It's an exciting journey. It's good to see where you guys are headed. I will now turn it over to Gina to talk about Youth Behavioral Health Navigators.
Thank you, Jennifer. I'm Gina Capadou. I am the program coordinator with Kids Mental Health Pierce County. I also have supporting me in the background our program director, Ashley Manga. And so I'm here to talk a little bit about our Youth Behavioral Health Navigator program. Jennifer, next slide, please. So I love this slide because it gives some context to what I think a lot of us on this call have a really good conceptual understanding of, is that our youth today are going through behavioral health and mental health crises. So Governor Jay Inslee signed back in 2021 an emergency proclamation just recognizing the level of crises for these kids. What we've known and what we're seeing is that behavioral health crises, they come in a lot of different forms. And as a result, there's no single system or entity that's going to have full leverage to be able to address those really multifactored complexities that we're seeing to be able to serve children and their families within their communities. Particularly, there's multifactorial determinants of kids ending up with psychiatric boarding in emergency departments. And given the complexities, we're going to have some really great partnerships and collaborations to have solutions to meet those needs. Next slide, please, Jennifer. And so that's where the Youth Behavioral Health Navigator program comes in. And so what that looks like is standing up community-wide teams that are convening to support the kids and the families in their regions, in their communities. Part of that is building an access portal that is going to be regionally specific to where that child and their family lives, so that they're able to reach out, get supports, and get resources and partners that are directly in their community. It also consists of convening what we call multi-system disciplinary teams, where we're pulling partners, again, from their communities within their regions that have some assets, that have some partnerships to serve that child and family with what they need in that moment while they're building long-term partnerships and resources. And what's really important is that for the youth that are really needing intensive services, those are prioritized for requests for support by these navigator teams. Next slide, please, Jennifer. So in partnership with the Healthcare Authority, Kids Mental Health Pierce County is also working with the Department of Developmental Administrations, many of us know as DDA, and that consists of standing up 3 regions per year for the next 3 years. There's technical assistance and support that is provided and really building collaborative learning teams across the state so that there's pathways for real-time input on understanding each region's strengths, their needs, and then really developing that partnership across the state. For fiscal year 2023, what that's looked like is partnering with Greater Columbia, the Salish community, and the Southwest area. Next slide, please, Jennifer. And so if you have any questions or any comments or want to know where your region's at in the development, all of our contact information is on this slide. Thank you.
We'll turn it to Diana
Thank you,
for
Gina.
any additional thoughts. There you go.
Thank you, Gina. One update for folks. Edward Michael has joined the Division of Behavioral Health Prenatal through 25 section as lead for our end on this work, partnering with Gina and Ashley and the team.
Glad to have you, Edward. Moving on to short-term residential crisis stabilization with Mandy for round 2.
Hello again. So I will talk about the, again, Residential Crisis Stabilization Program, or RCSP as we refer to it. So this is a 24-hour, 7-day-a-week intake, treatment, and supervision of youth and young adults in a safe and therapeutic environment. This is a really new innovative program, and so there will be a short-term stay of 30 days, not to exceed 90 days. There will be services for youth and young adults with behavioral health co-occurring conditions. And so this will be really a no wrong door program. So basically any youth or young adult who needs access to this, whether they meet medical necessity or not, at the acute hospital, for example, will be eligible to go to the RCSP for further crisis stabilization. And so we have been given capital funding for 2 sites, one on the east side and one on the west side of the Cascades. And so this will be 2 16-bed programs. And then we also have operational funding that's allocated in coming years for the facilities. So there have been 2, Department of Commerce has put out requests for applications. They did an RFI or RFA, sorry, and they are currently in the process of looking at the applications and potentially opening that up again, looking to make sure we have the right programs that have applied that will be able to offer this. And so part 1 is really just to secure someone that can provide, or agencies that can provide both programs, one on the east side, one on the west side again. And then really working at part 2 is cross-agency coordination to work to ensure the programming and everything is happening for this specialized program. And so we have essentially been working to get these out the door and to fund 2 programs, but we're not quite there yet. So work continues.
Perfect. Thank you, Mandy.
Thank you.
Last but certainly not least, Amy Dora has an update for the Substance Use Disorder Family Navigator programs.
Thanks, Jennifer. So, hi, everyone. Thank you for this opportunity to just be here with you during this busy time. My name's Amy, and I work as a co-occurring program manager on the Prenatal to 25 section within DBHR at the Healthcare Authority. The 3 projects that I'm going to speak about and give updates about are separate but connected projects, and they often work together. These projects use a mixture of substance abuse block grant, SABG funds, the general state funds, and the Blake funds, otherwise known as Engrossed State Bill 5476. Next slide, please. This is our partnership with InRoute. This project helped develop and produce the substance use disorder family curriculum online learning modules with an in-person training option, a participation workbook, train the trainer materials and education, and a supplemental toolkit. Currently, InRoute's main focus is on providing technical assistance for implementing the SUD family curriculum through Washington State Community Connectors, otherwise known as WSCC. As we move to the next slide, we're going to take a more in-depth look at what this training entails. I'm ready, Jennifer.
See it?
Yes. So here I'm just going to take a moment to share a little bit about the Substance Use Disorder Family Navigator training. Washington State Community Connectors and their partners implemented a training to educate families about substance use disorder and related treatment options across the state. The training is for parents, family members, caregivers who are interested in learning how to support their loved ones who experience substance use disorder. And also SUD family navigators can participate in this training. Participants have the opportunity to learn up-to-date information about SUD, addiction, its effect on the adolescent brain, skills for the families, navigating their relationships with someone with substance use disorder, and system navigation. The training is grounded in research and information supported by substance abuse and mental health services. Some of us just say SAMHSA, including their training and technical assistant partners. There's a toolkit including information and resources regarding substance use disorder supports and services specific to Washington State. And there's also a reference guide for participants. The training is actually a 16-hour course split into 4 days of 4-hour modules, and attendance all 4 days is required. So next slide, please. So this is the family SUD, the SUD family navigators. They support parents, caregivers, and other adult family members of individuals experiencing SUD related challenges through assisting them with navigating the system of care, supporting their loved ones, and managing their own health and well-being. Services are provided by trained and certified family support peers who have lived experience with SUD within their family. That's all I have for you today, but please reach out if you have any questions or need additional information from me. I'm happy to help. And I'm turning it back over to you, Jennifer.
Thank you, Amy. So I know that we've provided a lot of information today across 10 programs. I will open it up. I'm going to stop sharing and open it up for chat and questions from the audience. One thing to note before we go, if you are looking for any information on what you saw here today, I will put in the chat the link to the slides from today and from previous presentations. This is being recorded. That will go up as well on the same website to reference for later, or if you wanted to share with others. We are going to pause this for a while as we go through legislative session, as we all partake in that, and we'll be very busy, as will all of you. And then the third thing Diana touched on earlier is we will be sending out a survey for people who've participated in this webinar series October through today. Just trying to get some feedback from you guys on what we're doing well, what we can do better, and what you'd like to see as we head into 2023. So I'm going to stop the share and open it up to all of you for questions. Oh, and I'm always so grateful for those who have already put in the link to the slides. Thank you. I have one in one for Stephanie, on the parent portal and the BH360. I know you guys are still in development phase. Do you know when there'll be something that you could like Google or like a web link where you could reference that platform, or are you still in development?
Great question. The answer is yes to both, meaning that we're still in development, and yes, there is a link that I can share in the chat, which will give folks a greater sense of what it is to get onto the site. We have it fully built out for one workflow in essence, which would be for depression. And so folks can get on and get a sense of what kinds of information they'd have access to, what the parent toolkit looks like, as well as just what the look and feel of the website is. And then I will, of course, continue to keep everyone updated here as we continue developing the site. And we are evaluating and seeking some private funding to do a pilot, in which case in about 2 or 3 months, we'd have much more content built out on the site as well.
Thank you, Stephanie. And then I won in the chat also for Larissa on Clip. Could you speak a little bit more about the difference between current bed capacity of 52 beds and the monthly average use of 37 beds? Is this meaning there are more capacity than we have been utilized? Insights on how and why.
Thank you for the question, Taku. Yeah, so there are currently, we have a total capacity of 52 clip beds, but due to ongoing workforce challenges, the average monthly utilization rate has been closer to 37. It did bump up a bit just last month, but and programs are starting to see some increases in those beds. But the workforce challenges have continued to be extremely daunting, but their programs are working at staff hiring and retention. And so we're hopeful that that utilization rate will continue to increase.
Thank you. I have another question for Stephanie. Do you know how long your survey is going to be open for people to participate?
Yeah, we've had it open for a little while, and given that I just posted it today, we'll keep it open probably through end of January as we continue to present on the content and information. So people can feel free to take their time getting in there and answering some questions.
Perfect, thank you. All right, I will continue to ask the questions that are coming through. For Ashley, for Grace Harbor, can you tell us a little bit more about what a family preservation model is?
Yeah, I sure can. So my working definition of it is that the goal is to keep families together, right? To ensure that that parent-child bond is intact. So that would look like families staying together while a parent is receiving residential treatment. And it would also look like the family being included in the continuum of care, as well as in the care being received while the parent is in residential treatment. So it really looks like keeping families together, preserving the relationship with the parent and the children, as well as creating a continuum of care that is family focused rather than individual focused. And I'm happy to elaborate on that more as we move through the process of developing this project. Thank you.
Beautiful. For Gina, for the Regional Youth Behavioral Health Navigator program, what are the top things that you're most excited to come?
Well, it might help if I take off this piece there. There we go. Gosh, so I might lean on Ashley for this one also, but I think for me, what's been so exciting is really seeing how the work is catered and customized to what each community needs it to be. Every community has got different geographical reach, it's got a different culture, there's different politics. And so really being able to just technically support making this theirs and having the community buy into this and the community take ownership and grow it and make it what they need it to be. I think that's the part of the process that I find most exciting. I don't know if Ashley's still on. I know she's had some internet issues, or if there's anything else that our team wanted to add.
Hey, Gina, this is Ashley, and I agree completely with what you said. I think what makes this work exciting is bringing the community into the system in a way that we haven't been able to do in the past. And so I think when we're able to build those relationships and those connections, we really create a different safety net for kids that just isn't a behavioral health system, but a community at large that really is able to link arms to really support our kids and families. So we've seen some really unique outcomes here in Pierce County, and really excited to see what can happen across the state when we have other community coalitions and supportive efforts like this. Diana.
Oh, that's my clapping hands. What you said, Ashley. Yes.
That's a raised hand. Thanks.
Being sensitive to time, one last question for Rachel Baxter on the education for discharge planners. What are the unique development needs for TAY discharging from inpatient treatment facilities?
So the unique needs for TAY that are discharging inpatient treatment facilities really is that a lot of young people don't have the support or the knowledge regarding, financial assistance, conflict management, rental experience, how to work with a landlord, their insurance, their medical coverage, as well as, other important resources for stability, such as finding their medication, how to pick it up once they're discharged. We know that being homeless can cause an exorbitant amount of stress and trauma on individuals. So that can really cause these young people to then go back into treatment. And we're really trying to prevent them going in and out of treatment facilities, as well as any interactions with the homelessness system. Thank you.
Thank you. And just really super fast, Cara has a question for Mandy in the chat on RCSP, building out 2 16-bed site, one in Eastern Washington and one in Western. Do you know where it will be located in Eastern Washington?
Thank you for the question. We actually don't know where it will be located yet. That is part of the process when we are looking at applications and really looking for providers. So we don't have a location yet, but we do want one for families in the community in Eastern Washington and Western Washington. So stay tuned.
Perfect. With that, I want to say thank you for everybody coming and attending today. I wish you all a lovely winter holiday season, however you choose to celebrate. And we look forward to seeing you in 2023. Have a good day, guys.